Hi, I'm Dr. Craig Tuttle. Welcome to my home today. We're going to talk about posture. And the first thing I want to talk about, there's two main types of posture that we think of, usually sitting posture and standing posture. Sitting posture is really important because unfortunately we do that a lot. And ideally we're bipeds. We're designed to be moving most of the time. And so when we do sit, it's important that we have good alignment and good posture. I'm sitting in a chair right now, and I'm going to demonstrate some sitting posture techniques that will help you put less stress on your alignment of your neck and back, but also put less stress on your muscles in your body, causing you to not develop trigger points and knots within your muscle tissue. So first of all, if you're going to be sitting in a chair, what we encourage is that you want to keep the S shape of the 24 vertebrae in your spine. And so the best way to do that is to sit as far back in the chair as you can and take a pillow. If it's a deep chair, like in this case, it's a very deep pillow, a deep chair. And I'm going to take this pillow behind my back. I'm going to put it about where the mid and lower back meet. We call that the thoracolumbar junction, but it's easy for the women. It would be right at their bra strap line. For a male, I encourage you to take a fist behind your small part of your lower back like this, and put one fist above it, and that would be your thoracolumbar junction where your mid and lower back meet. That's where you'd want to put a support or a pillow to support, cushion the back there. So we're going to take this pillow here, and I'm going to demonstrate. I'm going to put it right in my mid to lower back area, right there. And when I lean back against it, it supports me, but it also keeps the S shape and my alignment in good alignment as I sit. And I can sit and watch a TV program or have a conversation with somebody or at a dinner table or chair. That will help keep your alignment and put less stress on your neck and back. And it will keep muscle knots from forming and keep your body in alignment so that your muscles and ligaments don't tighten up around your spine, leading to what's called a subluxation or misalignment of the spine. The alignment's important because as you keep in alignment, not only are you preventing muscle knots and spasms and trigger points in your muscle tissue, and also we said it keeps your alignment, but also it'll keep your nervous system flowing, your brain being able to send messages down your spinal cord, out between your 24 segments of your spine called vertebrae, allowing those messages to flow and keep the body healthy and functioning well. So posture is really important. We stated in one of our other videos that one of the main types of stress on your body is physical stress. And under physical stress, one of the main types of stress on the body is our posture when we're sitting. That's why it's good to put a pillow behind your back if you're watching a TV program or you're just sitting and relaxing, talking to family or friends. Next thing we're going to talk about, I want to demonstrate how to sit in a couch properly and keep good alignment for your posture. We're going to transfer over to this couch right here. And when you're sitting in a couch, what's important is that I like to sit when I'm sitting in a couch here. I'm going to grab a book just to demonstrate how to read if you were sitting in a couch to put less stress on your neck and back. What I like to do is I put a pillow in the corner of a couch, and I'll lean back against that pillow, and it will help support my alignment when I sit back against that pillow. So it forces me to keep the S shape to my spine. Unfortunately, what we do often is that we'll sit back in a corner of a couch or against the back of a couch, and we'll look like this. Although it looks comfortable for a short period of time, what will happen is it causes your spine to develop a C shape, causing the muscles and ligaments to tighten up around your spine, causing your spine to get out of alignment and put pressure on those vital nerves sending messages into your body. So you want to avoid that by simply taking a pillow, putting it behind your back. It forces you to keep the S shape to your spine. You have better alignment. And then when I read, what I like to do is I'll put a pillow on my lap, and I'll support my forearms on the pillow, and I can read a book like this, and I'll either put one hand underneath my shoulder, and I can read with my head centered over my shoulders, and your ears should always be in line with your shoulder here. And when I look straight ahead, I want to read so that I'm looking as close to parallel as possible. And I can rest my arms and I can read like this for a long time. Or I can rest them, or I can stack up pillows here on my lap and be very comfortable and read for a long period of time without my neck and back causing stiffness and tightness in my alignment. Versus, unfortunately, a lot of times when we read, we're in this position a lot, which then causes all kinds of stress on the neck and back, because as the ear goes in front of the shoulder, it will tighten up all 7 bones in the neck region that are trying to support the weight of the head. And as that head on a typical human being weighs between 10 and 16 pounds, as that head leans forward, the weight of the head will then cause all the muscles and ligaments to tighten up around the neck, causing those muscles and ligaments to squeeze and put pressure on the nerves. It'll also cause stiffness in your neck and cause all kinds of problems with with the nerves that are trying to flow out between the vertebrae. So remember, you want to try to keep your ear over your shoulder and your shoulder over your hip socket. Those are the three connecting points when you're sitting. You try to focus on having good posture. The other thing is, as you're sitting, visualize a string attached to your chest bone, and you want to have that string being pulled up at a 45-degree angle. We refer to that as sternum up or chest bone up. So as you keep that sternum up versus being into a slouch posture like this, that'll force your head to go forward and cause you to lose the S shape of your spine and developing what we call a C spine, or a letter C shaped spine, which is poor posture and causing the mid back to be pushed outward. So that's a little bit of information on sitting posture. We're now going to talk about standing posture. So let's take a look at when you're standing, what you want to try to shoot for when you're in a standing position. You want to try to stand so that your ears are parallel to the floor. You want both ears balanced, your shoulders and your hips. The main thing I try to focus on when I'm standing is if I'm going to turn sideways is visualize a string attached to your chest bone, and it's pulling again up at that 45-degree angle. We call that sternum up. So when you stand, you want to stand with your chest bone up. You don't want to hyperextend like this, okay? Like we call that Gomer Pyle posture. We don't want to have that posture like that. And we don't want to round our shoulders, causing our shoulders to roll forward. And unfortunately, as we age, a lot of times we'll start to notice our posture will look more rounded like this. And we want to avoid that posture by just being conscious of lifting your sternum. And remember that phrase, sternum up. I like to every so often just pretend like I'm pinching a string into my chest bone or my sternum here, and I'm pulling upward at a 45-degree angle. So when I stand, what I try to think of is keeping my head balanced over my shoulders by keeping my ear over my shoulder and my shoulder over my hip socket. And lastly, in a standing posture, we'd have our hip socket over the outside bone of our ankle here, called the lateral malleolus. And it's important that those 4 points connect. So ankle bone, hip socket, shoulder, and ears. So from the side view, we're basically standing in this posture with good alignment in our body. And what we want to avoid, again, is dropping that sternum. And unfortunately, that's usually when postural stress will occur as we drop our chest bone, which then forces our head forward, causing a condition called forward head posture, which puts all kinds of stress on your neck and shoulders, tightening up the muscles, and again, putting pressure on the nerves. We're now going to talk about the spine and its relationship to posture. Our spine, as you may remember, is made up of 24 movable segments called vertebrae. And these are the bones in the lower spine are called the lumbar vertebra. The ones in the middle back are called the thoracic. And there's 12 of those, 5 in the lower back called lumbar vertebra. And there's 7 bones in the neck called cervical vertebrae. There's a total of 24. And the importance of the spine is that it does a couple of things that are really important. It supports the weight of the head, which a human being's head, we said, was between 10 and 16 pounds. And we want to keep that centered right over the top of the spine. And then also it protects all the nerves and the spinal cord. So right at the base of the skull, I'm going to turn the spine around. This would be our back. These are the bumps we feel in our back. Here's the base of our skull. And of course the brain is sitting inside the skull here. But all the messages from the brain travel through this cord right here where the brain connects to what's called the spinal cord. And it travels down the middle of the spine in between each of your vertebrae. Here as we bend, you can see this yellow portion right here in this particular model. This is the spinal cord. It's about as big around as your little finger, and it travels down, the bones are all donut shaped, and it travels down the middle of the spine. And then between each of the bones on either side, the right and left side, are the messages flowing from the spinal cord through spinal nerves. You have 31 pair as they flow out and send vital messages to every part of your body, every muscle organ and gland and every cell of your body. So the harmony and the flow of the messages from the brain down the spinal cord out through those nerves is vital to keep the body working healthy. Posture is important relative to that because as you sit and stand, that will determine your alignment. And we want to keep the ideal position of the spine from the side view. It should have a nice S shape to the spine like this here. So basically from the side view, this is what our spine should look like. Our spine should curve slightly forward in the neck to act as a shock absorber for our head being 10 to 16 pounds. And then should slightly go out between the shoulder blades. And that protects all your vital organs and keeps your spine in alignment there. And then your lower back should go slightly forward, and that's your lumbar spine. So you have this S-shaped contour to your spine that you want to keep that S shape. We develop those cords typically when we're babies, when we're learning to crawl. And as we do what's called cross crawl pattern, it demonstrates and allows the stomach to sink a little bit, so it puts that curve into the lower back, then with a slight curve between our shoulder blades. And then as we look up, as babies are crawling, they'll start to develop the curvature of the neck. So we want to maintain that S shape throughout our lifetime. And that's a chiropractor's job, is to make sure those bones stay in alignment, taking pressure off those vital nerves. Okay? Looking at the spine straight on, I'm going to stand up and demonstrate this. From the straight on picture, we should have a straight spine like this. That's the importance of keeping your chest bone up as you stand and keeping the spine. This plastic model is basically about the same size as my height right here. And so the spine should be as straight as possible from the front view, but from the side view, we want to have this nice S shape to our spine as it curves forward into the lower back, slightly out in the mid back, and then forward into the neck. So that's the purpose of the spine, is to protect our spine, our spinal cord and nerves, and also to allow proper alignment to support the weight of the head. And as we stand and sit, we want to keep that S shape to our spine, and the spine to be as straight as possible when we're standing and sitting. So that's a little bit about standing and sitting posture today. I want to thank you for coming and listening to our talk on posture. If you have any questions, you can contact me at my office. Or if you'd like to come in for an initial exam, we offer the examination for free so that we can check your posture and check your alignment and see if you have any pressure on your nervous system. So thank you for coming today. You can go to our website at yourseattlechiropractor.com. Thank you.